Welcome to yet another episode of Health Diary. My name is Gladys Gachanja. We are coming to you from the Garden City residences. Now, the World Health Organization reports that Kenya continues to face a rising burden of diabetes. Of most concern is actually the rising cases of diabetes amongst the youth. So today we find out why and how, and also spotlight on the fact that being diagnosed with diabetes is not a life sentence. Before we get to that discussion, here now is the fact of the matter. Diabetes mellitus, or commonly known just as diabetes, is a chronic disease in which your blood glucose or blood sugar levels are too high. This could be an indication that your body is either not producing insulin to break down the glucose or is not using the insulin produced well enough. The common types of diabetes are type 1 and type 2 diabetes. For type 1 diabetes, the pancreas produces little or no insulin. Different factors including genetics and some viruses may contribute to type 1 diabetes. Although type 1 diabetes usually appears during childhood or adolescence, it can develop in adults. For type 2 diabetes, your body either resists the effects of or doesn't produce enough insulin to maintain normal glucose levels. Type 2 diabetes used to be known as adult onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise in childhood obesity.
Now that one will give you how much?
My name is Khadija Abdul. I am in Form 3. My best subjects are history and science.
Can you see what you get?
I would like to be a journalist. I've been diabetic for 5 years right now. I used to urinate a lot, get tired, thirsty at all times, hunger. So my mom was told by her friend that maybe it might be diabetes. My mom's friend, since she was diabetic, she tested me with her glucometer, and then they found out that my blood sugar was high, so I was taken to hospital. And from there, I had medications until I was discharged. I was 12 years. They couldn't tell me in details, but they told me that I wouldn't be able to take sugary things at that time. So I couldn't understand. I was really angry. And then, like the doctors, as they were monitoring me and stuff, they told me that many children are living with diabetes like me, and I got a chance to meet all of them, and they gave me their storylines. So then I just tried to accept it. My mom was the one who was doing it, at times my cousin, and then like I went to hospital during the checkup. They told me that at some point my mom might not be there, or whoever was injecting me, since I had support from the nurses. So like I would just go every single morning. I go there, inject myself, then go for breakfast. In the evening, I do the same. The people who knew that I was diabetic were only my closest friends and my classmates at some point. And I never wanted them to tell many people that I was diabetic because I was fearing that I might be discriminated. My message to the young people is that diabetes is a controllable condition. They should not fear it. If I live with diabetes and I'm okay, then they can. Surely they can.
Welcome back. Well, according to the Department of Pediatrics and Child Health at the University of Nairobi, they say if diabetic children or adolescents are well managed, they can actually enjoy and live a full normal life. So Khadija's story goes to affirm the same and to dig even deeper as to how that can actually be made possible. With me is Dr. Salwa Shahbal. She's the founder of Diabetes Management Center. Thank you for your time. And Juan, Muniu, who is living with diabetes. Thank you for joining us. Now, Dr. before we get to Juan, let's talk about the fact that Khadija's story clearly shows that diabetes is not a life sentence, right?
Yes, and that's what we're trying to achieve with the care that we're trying to provide to our patients living with diabetes. So most parents usually have the biggest issue when the diagnosis of type 1 diabetes is made. Okay, and you'll find that the child usually acclimatizes really fast. They get used to the needles, they get used to the doctor, You know, I have children walking into my office and the first thing they do is come and hug me. Yeah.
Okay.
But the most stressed person in the equation is usually the parent. And it's very important for them to understand that with the proper knowledge and education to both the parents and the child, then these children usually live a perfectly normal life.
For you, Juan, you were diagnosed at the age of 17.
Yes, I
and
was.
You were told you have which diabetes?
Also, I have type 2,
What were the
unfortunately.
symptoms?
Dehydration, and it was hunger, and then the one thing that really stuck was fatigue. I could really get really tired so quickly, and then dehydration was really affected me then, because I used to take a lot of water then. Yes.
And are these
And weight
symptoms
loss.
that you found later in life, or were you struggling with them throughout your life before you were diagnosed?
I was struggling with them before I was diagnosed. So that's when they got really serious, that my parents decided to take me to hospital to see what's up.
Now, Dr. Salwa, earlier you were saying you have a feeling he was misdiagnosed and it sounds more like type 1 rather than type 2.
Actually, he's one of the few patients who tend to have the classic symptoms of diabetes, although we see a lot of type 1 with them, which is what he's saying. The dehydration, I'm assuming you were passing a lot of urine and really thirsty.
Yes.
But no matter how much you drink, you're still really thirsty.
Yes,
So you
very
unquenchable thirst. And he talked about weight loss.
Yes.
But you were very hungry.
Very.
So you'd find they would eat a lot, but they're continuously losing weight. So it doesn't match the amount of food. Parents actually come in complaining that the boy or the girl would be eating a lot and they're not gaining weight, okay? And these vague symptoms of fatigue that he mentioned, that's very important. A child could just be tired all the time and refusing to go out to play, yeah? And that already should ask, should raise question marks. So I think he's type 1 because from diagnosis, he was started on insulin. We have type 2s that we can do that if they're in what we call glycemic toxicity, okay? But the fact that for the last 10 plus years, he has not been able to be withdrawn from that insulin and put on oral medication, that's already a sign, could he have type 1 diabetes? So usually at the beginning, most patients with type 1 diabetes require insulin immediately and they can't be off of it.
Okay, now you're 27 years now,
Yes.
you were diagnosed at 17 and you have a twin brother who was
Yes, I
also
do.
diagnosed with diabetes.
Yes.
Did they tell him he also had type 2?
No, they didn't, because the time that he was diagnosed, we didn't refer to the same hospital that I had been referred to first earlier. So when they diagnosed him, they found out that he had type 1. So they started researching on the family matter. These guys, I think they were more serious than the first ones.
One important thing that most parents come to the office wondering about is, how does my child have type 1 diabetes? We don't have diabetes in our family, which is what he said. And what they need, what the public needs to understand is type 1 diabetes is not related to family history. You don't need to have a positive family history. That's type 2 diabetes.
Are there things about your lifestyle that you've had to adjust, some you have had to cut off or stay away from totally?
Oh yes, most definitely. I had to change my diet. I had to change my lifestyle completely. I have to exercise a lot. I have to be careful of what I'm consuming every day. My sugar intake has gone like way beyond 0. I can say it was easy adjusting to it. At first it was terribly like awful, cutting all the sugar, all the juices and all the fun stuff. When you show up to a party and you can have all the fun stuff.
According to the 2015 Kenya Stepwise Survey for Non-Communicable Diseases Risk Factors, it shows that those who consume processed food, which is a high in sugar, those between the age of 18 and 29, which is the same bracket you're in. Now, those statistics, do they kind of explain why there seems to be an increase of diabetes, especially 2 in the younger generation?
10 years ago, how many billboards were around talking about processed foods? How many franchises of fast foods were there in Kenya? Okay, all these factors play a huge role in non-communicable diseases such as diabetes developing. So if, for example, the government decides, I don't know which ministry is involved in these things, but if the government decides every month we're going to have a billboard regarding healthy living. Yeah, I think that will change the mindset. If you remember, there's a controversial billboard of a company who put up a biscuit and it had the wrong saying, a biscuit a day is all that you need. I won't mention the company name. And the Nutrition Society of Kenya made sure that it was put down. And that might seem petty to some people, but you see that 3-year-old, that 5-year-old who's driving up that highway is looking at this billboard and actually consuming that information and thinking that all you need is a cookie a day to be fine, okay? We live in the part of the world where we can still have organic meals, yeah? It's way cheaper to have sukuma wiki, but children are children, yeah? And they would want what everybody else wants. When he said he had to make those changes, those are not changes, abnormal changes. Those are changes that we are all supposed to do. A patient with diabetes does not have a special meal. All of us should eat like that. You get my point? Yeah. So yes, people in that age group are getting more diabetes, and we're seeing that purely because of the wrong lifestyle choices. Yeah.
When you speak about eating healthy, what are we eating?
Fast food aside, first of all, because I can go for sweet potatoes, go for arrowroots, go for sukuma wiki, go for matoke, all those kind of, healthy, not the fast food, not the food that you put in a pan, 5 minutes they're ready. And
they're ready to go. Yeah. And this must make you very strange around your age group, because most people would rather be eating the junk. Yeah, true. But you have to stand on your own 2 feet because you've got a life to protect, right?
Yeah, very true. When we show up to a cafe or a restaurant, I have to look at the menu and see if they have something which fits me. Most restaurants nowadays don't offer that, so I have specific places I have to visit.
Okay.
So that's kind of hard for me.
Daktari, after the break, we'll come back and talk about how you can also control the diet when it comes to the younger generation, because at least they answer to a guardian or a parent, and how important it is to actually watch their weight when they are still young. And when we come back, much more about how to treat diabetes and, of course, how to manage the same, because again, as we're saying, it's not a death sentence. It's something that you can live with and have a normal life. Stay with us. Welcome back to Health Diary. My name is Gladys Gachanja. Before we went to break, we were talking about healthy living and why it is important to be aware of what you are eating, and especially amongst the young generation where type 2 diabetes and any other form of diabetes, actually, as Dr. was saying, it seems to become or to becoming prevalent. Now, Daktari, let's go back to the fact that we have a younger generation that is learning from the older generation in as far as what's put on the plate. When you go to a restaurant, most often than not, the parent will say, chips is for the children.
Yeah.
What does that say, and what has that led to?
Okay, it leads to a lot of challenges. First of all, you're basically teaching your child that the unhealthy stuff is okay to be eating every time. You can have chips. Okay, we're not saying don't give your child chips. You can have chips once in a while. We're discussing about healthy choices. So why put them in a fryer when you can easily put chips in an oven, for example? Less oil, right? But the choices we make as adults really affect this child when they grow up. I have adults in the office coming in and saying, our culture, when we cook, we don't have vegetables on the table. So when I need to move such a patient from no vegetables to half of your plate requires to be vegetable, it becomes very difficult. And this image that a healthy plate is for people who are into fitness, or if it's for people who have diabetes. I always tell my patients, if you look at things positively, you look at your diabetes as a miracle. You're going to sit back and say, Were it not for this diabetes, I'd be eating the way I want, which is unhealthy.
True.
I will not be exercising, okay? So diabetes forces you to exercise. Diabetes forces you to choose from a menu in a restaurant the healthiest option,
True.
okay? And it makes your family members eat like you. If you're the father who has diabetes, you're the main person in the home, your wife has to cook for you. And I always tell them, don't cook a separate sufuria for the patient with diabetes, because that's usually what happens. What a patient with diabetes eats is a healthy way of eating. And you always make it fun. In the morning, you don't have to have spinach on the side and a boiled egg for your child to eat. You can make a sandwich with vegetables inside. Okay, make it fun, make it interesting.
Now, Juan, you were mentioning earlier, there's some things that you saw growing up that you don't see nowadays, cartoons that emphasized eating right.
True, true. So while growing up, we had this Popeye the Sailor. So unfortunately, a lot of people didn't get that while growing up. But the whole purpose for the Popeye the Sailor was to encourage kids to eat veggies.
And just in case you're wondering, Popeye the Sailor was a guy who took the spinach and then he would grow muscles.
Grow stronger, and
Yes.
he was like Popeye the Sailor, and he would move mountains with all that strength. So we have seen a lot of change while growing up. Adverts, and even when we go to the cartoons, they have changed all that. Eat burgers, eat fries, eat juice, and you get energy. So that kind of like changed the whole set about growing up.
And the same applies to physical exercise, because that age group, young and of course into the adolescent and young adults, exercising is not a priority, yet it's one of the preventative measures of ensuring that you do not, you're not diagnosed with diabetes or any other NCD.
The games. Don't have your child running in Karura with you, yeah? But you can have them riding a bike with you. And I see a few, because I do a bit of walking in Karura, and I see families with their children on their bikes, and it's amazing. That's physical activity, okay? Instead of sitting on an iPad, yeah, or in front of the television, okay? So more games, physical activity, not
PlayStation and all that. Yeah.
Not computer games, more like physical games, you know, football. If girls want to go out and run around, you know, I don't know, what did you play when you were
young? We played kati, we
Yeah.
played, you know, dodgeball,
Yeah.
is what they call it.
Everything, yeah. So that, take your kids out for swimming if the weather is, you know, allows, and things like that.
Let's talk about treatment. One, I mean, living with diabetes is an expensive affair, and especially on a personal level. You talk about having to inject insulin on a daily basis, and you also have to eat healthy, which is also an expense in itself. How do you handle this? Let's start with the medication.
It's kind of hard. I wouldn't say it's an easy life, but you have to adjust it, or psychologically and also physically. Physically, when it comes to your dieting and everything. So medically, for me, it has been easier. It has been made easier for me since I consult with DMI. That's upper hill. When I was diagnosed with this, and when they came in, they made my life easier, because they used to supply insulin for free for me. Budgeting and everything was cut into half for me.
An injection of insulin, how much would that cost you on a daily basis?
Okay, it depends which type of insulin you're using. You can have a vial, which is about 500 shillings, and you can have a pen of insulin, which has almost half the amount of insulin as a vial, going for about 3,000 shillings. So this is where the catch is. When you can afford the vial, you probably can't afford a fridge. Yet the vial requires you to have a fridge, you know, somewhere cool to put it. Yeah. So sometimes we actually teach them how to do, you know, these homemade fridges.
Yes.
Yeah. It's also, I think you can find them on YouTube as well. With the pen, the convenience is painless injection. Okay. And it can be out of the fridge for up to a month. But how many can afford it?
NHIF, has that been of help?
I wouldn't say so, since it doesn't cover that.
It does not cover?
It doesn't.
Is that the case?
From my knowledge, there is no cover for diabetes the way there's a cover for dialysis for patients. There is no cover offered by NHIF. I stand to be corrected, but I haven't heard, I would have heard about it, about a special cover for diabetes under NHIF.
For you, you've been lucky enough, at least it was diagnosed earlier enough, but there are some people you know that have not been as lucky.
True.
Speak on the same.
I have lost a friend who was struggling with the same issue, and when that happened, really my world stands still, because I was like, what made this guy lose his life, and what could I be doing wrong that might lead me to the same direction? So I got more curious. I started researching. I started being more serious with my life. I wouldn't say I was so serious afterwards, but when this happened, I got more serious. It really affected my life, since this guy was a close friend of mine, and they died from the same thing.
What would be a clarion call to policymakers?
First of all, the story about his friend has really touched me. And how old was he?
He was 25 then.
The working class. Somebody who's just finished uni, who's ready to build the country and build the economy. And we lose him over something that we can manage.
Yeah.
Okay? We have insulin. The greatest thing you could ever have is access to insulin. Okay? And what people need to understand, and policymakers need to understand, is we need to prevent diabetes. So we're talking about mostly type 1 here, yes. But 90% of patients with diabetes are type 2 diabetes. And 90% of type 2 diabetes can be prevented purely through healthy living. And that's cheaper than getting diabetes. Secondly, when you already have diabetes, the key issue is to make sure that you have no complications. NHIF is busy paying for dialysis. And I can assure you, if we get statistics from those dialysis centers, a majority of those patients visiting the dialysis centers are there because their kidneys have failed secondary to poor controlled diabetes. So if we managed diabetes, we wouldn't need to spend so much money on dialysis. It's plain and simple.
Very well said. Dr. Salwa Shahbal, founder, Diabetes Management Center, and of course Juan, Muniu, living with diabetes. Thank you for your time. We have been talking about diabetes and the younger phase of diabetes. As the doctor has said, these are preventable diabetes and conditions if only people can be awoke about what needs to be done, and also the policymakers to put it in place so that we prevent other than treat. Well, this has been Health Diary. Next, the health tip.
Yoga is a practice of body and mind. Most of people are now sitting in the offices doing their own things, and you find people are growing big. They don't walk. Everyone is just driving, and it makes them lazy. But when you come right to your mat and do yoga, you can walk, you can run, and that is how life is. Yoga has no age. Yoga has no boundaries. Yoga is for everyone, and it is part of well-being.
It has been Health Diary. Thank you for your company and for your suggestions coming through to us on our social media handles. And until next time, my name is Gladys Gachanja, and we've been coming to you from the Garden City Residences. See you.